So the other change that patients will really notice is that doctors and GP practices are asking patients to buy more medication that they may have had on prescription. So there's been a national consultation, and there's 33 medicines now that patients really should buy over the counter rather than getting a prescription from their GP. First of all, the reason for that is because there's over £500 million across the NHS that could be saved simply by doing that. And it's really, where do you draw the line around what a GP should prescribe and what patients should buy? So, for example, soaps and shampoos, things like that, that really patients should buy themselves, where it's appropriate. And what that actually will mean is that patients won't have to wait for an appointment at their GP practice. We know it's getting harder and harder to have. So it allows the GP practices to focus on patients who really need their care, but also just allows patients to go directly to the chemist and have a conversation with them, because chemists are really good. They're very good health professionals about advising patients on that type of self-care. And the other thing to mention is it's really important for patients to have a really well-stocked emergency cabinet. So things like paracetamols and ibuprofens and cough mixtures and indigestion remedies, because we know winter's coming up, and it's difficult if it's Sunday evening and your child has a temperature and trying to get some medication. So if there are lists available from the chemists of emergency medications that patients should have for those kind of scenarios. And if we could ask all patients and all people to have a look at what emergency medications they have for those circumstances, it would really help them and help the health service.